Hello and welcome back. My name is Michelle Neskey, the PA PA School admissions expert, and I've got some big news. Yesterday, the U.S. News and World Report has once again listed the PA profession as one of the top 2 healthcare careers. And why is that? Well, I'm about to tell you. But before I do that, be sure to smash the subscribe button. I am here every month dropping new videos to help you get into PA school, become a successful student, and a fulfilled practicing PA. All right, so this year we were listed as the number 2 healthcare job in the country. Why is that? Well, every year for the last few years, we've been listed either number 1 or number 2. I'm gonna break down a few reasons why this profession continues to be in the top 2. With the first one being demand. A lot of people have been asking me if the PA profession is saturated. The answer is no, okay? As our patient population continues to grow and the shortage of physicians, particularly primary care, continues to grow, the need for PAs to bridge those healthcare gaps and provide high quality care to underserved communities or to those with lack of access to care becomes more demanding. Additionally, the advanced training that PAs have to be able to diagnose, treat, write prescriptions allows us to work in collaboration with physicians to treat patients quickly and effectively in areas where care is sparse, okay? So that's number 1, all right? Number 2 is flexibility and versatility. So a lot of people talk about work-life balance, and I'm a strong believer that no career will give you work-life balance. That's something you have to create for yourself. You can go out and find a lot of burnt out PAs right now that are not creating work-life balance. But I will tell you this career gives you the opportunity to create that for yourself through flexible options and versatility. What do I mean by that? So as a PA, we have the unique ability as advanced practitioners to be able to treat any patient in any specialty across the lifespan. That means this career can be adjusted to meet your professional and personal goals. I will use myself as an example, okay? For a really long time, I worked in full-time clinical practice as a medical oncology PA. Over the years, I've had the opportunity to be in leadership roles, administrative roles, heads of organizations, you name it. Research, I've been very fortunate to have all of those experiences. But as I got older and my life personally began to change and I had a child and I own a home and all of those things, I wanted more flexibility and more time to be at home. So I created the Posh PA where I help all of you get into PA school, become successful students, and fulfilled practicing PAs. Now, if you don't want to start your own business, that's A-okay. There are a lot of non-clinical opportunities for PAs, and I have a whole video on that here in the library. So that flexibility and versatility is something that people really want, especially in this day and age. So that is definitely by far number 2. The third thing is PAs are really known for their patient experience, to spend a little bit more time to connect with the patient and provide that connection and that lasting relationship and really be able to relate to patients on their level. I feel that is what is somewhat unique about the PA profession. A lot of professions can do that, but at the heart of this profession is patient care. And I really think that's something important to consider when you're thinking about different healthcare careers. The next thing, obviously, income, right? Financial stability. We've got to talk about that, right? We want to have a career that's going to provide us that financial stability that we want over the long term. And again, by adding some of these additional streams of income, you can even pay off your loans quicker and you can expand what you're doing beyond clinical practice, whether that's maybe, opening a practice with a physician or global health opportunities or starting your own what's the name escaping me right now? Starting your own nonprofit organization. I know a lot of friends of mine who have done that, and it's very fulfilling. So those are the main reasons I believe the PA profession continues to be ranked in the top 2, okay? Now, some people might say, well, Michelle, on the flip side, there are some negative aspects to being a PA. I think there's negative aspects to any healthcare career, but what are some of the limitations on the PA profession that you may not know about? So the laws for PAs are different in every state. And over the last few years, our national organization and state lobbyists have been working to expand our scope of practice and change the laws in each state, the antiquated laws in each state, so that we can practice to the top of our licensure in collaboration with physicians. And so sometimes, depending on the state that you're working in, some of the laws can be more limiting on what you can prescribe or practice location or that kind of thing, okay? So there are some limitations in that regard. Now, I will say that we do have a strong national organization that is working very hard to sort of help minimize what these barriers to care are, and they're very specific, and I'm not going to get into the nitty-gritty, but I also have another video on what are the potential negative aspects of being a PA, and you can watch that here as well. I will say this, every career is what you make it, okay? So whether you're a nurse practitioner, a PA, a physician, at the end of the day, there's a place for all of us in healthcare because there's so many patients that need quick, effective access to high quality care around this country and around the globe. So we all work together, and we all should be working together to support each other in our professions and really focus on the most important member of the healthcare team, and that is the patient. So there's room for all of us here, okay? But I will say this, if you are looking into becoming a PA, let me help you. I have tons of resources here on this channel, but also the opportunity to join my high-level group coaching course or book one-on-one appointments with me and my team of PA school admissions experts, and we can advise you on the best way to get into PA school the first time. I'd love to hear what your thoughts are on the rankings of US News and World Report. Let's keep it positive, okay? Let's keep it positive here. But I'd love to hear what questions you have about the profession, and if there's anything that you're wondering that I haven't answered on this channel. All right, I'll see you again next time.